Okay. We'll go ahead and get started with the folks that we have here. In part, some of what I'm going to say might be a repeat from the last time that we had our webinar last week. I do want to right up front make y'all aware we're going to have 2 more webinars in this little April webinar series. Next week will be on early recollections and how the earliest recollections that our clients have of their lives, how we can use that in a clinical setting. And there'll be a counseling demonstration that'll be involved. Really, this is the only webinar. Is that true? No. I was going to say that this is going to be the only webinar where we won't have a counseling demonstration, but also our last one, it'll be a little bit more informational and not, I don't think that there'll be a demonstration in that one, but we have one on early recollections coming up next week. And then the week after that, that'll be on a Thursday as well. We have one on mitigating anxiety from a pandemic. And so just talking about what are the things that we can do as clinicians and as helping professionals to help our clients with anxiety that they might be experiencing, pretty understandable anxiety that they might be feeling about the pandemic. In part, what we're going to be doing with that is pointing out some things that we might do with really good intent as clinicians that might really not be all that helpful, and just trying to reorient us and make sure that we're being as helpful as we would really like to be. And that's, of course, the assumption is that we really want to be helpful to folks. So, okay, for this evening. So my name is Calvin Armerding. I'm a licensed professional counselor in South Carolina, and I'm a senior associate here at Travelers Rest Counseling Associates in Travelers Rest, South Carolina. It's just a small private practice, my partner Lindsay and I, and we actually have another associate who's working with us now, Mary Bennett Pickens. The 3 of us, we spend most of our time working with couples and young adults. Lindsay and I both have a history working with children, adolescents, and their families as well. But most of our work now is done in the young adult and couples population. So just to give you a little bit of information about us, we both have been trained as Adlerians, and so a lot of what we're going to be talking about today about ethics in private practice, that's going to be coming from an Adlerian perspective through an Adlerian lens, and hopefully we can do something fun with that will be applicable for everybody, regardless of whether you're an Adlerian, but just to offer some insights from some things that we've learned. Okay, so again, I think everybody knows about the sign in on the right hand of the screen. I've mentioned that a few times. A couple just practical matters. After this webinar is over, Lindsay, my partner, she's going to email you evaluations for you to fill out, and once you fill those out and email them back to her, then she will send you a certificate for the continuing ed credit for this. Okay, so that'll be how that'll work. Please let us know if there's any trouble with that on any level, and we'll of course get it sorted out. Also, I want this to be as conversational and as interactive as possible. There is, I think it's probably like a 15-16 second delay or something between me talking and then it showing up on your screen. So that'll create a little bit of trouble. But if you have any questions or comments, I want you to feel free to type those in the chat window, and we'll try and pay pretty close attention to those so I can address them as quickly as possible. Hi, Phil. I just saw you sign in. It's great to have you with us. Hope that you're staying healthy. Okay, so here's what we're going to talk about tonight. We're going to talk about ethics in private practice. And look, this is, of course, no knock on any ethics presentation that I've been to. In fact, I heard Phil give an ethics presentation last year with another friend of ours, which was great. It was really fantastic. But I find that a lot of our conversation in seminars or workshops on ethics, they tend to resolve around our kind of most difficult cases. And of course, that's really appropriate, because those are the ones that maybe we struggle to figure out. We're thinking about, okay, when is it okay to break confidentiality? Where do you draw that line of where there's a safety concern? Where do you draw the line of having a duty to warn? When is it, if you're in a really rural setting, how might that change the dynamics of dual relationships or accepting gifts or bartering for services? And those are those are tricky things. They kind of sit in the gray area. Um, but for the most part, therapists, and this is both from my clinical experience, and then also I supervise some clinicians in training here in South Carolina. And what I find is that the ethical things that tend to come up aren't so much, should I sleep with my client or not? I mean, we feel pretty clear about that. And even things about confidentiality. I mean, most of the time, even in a fairly more acute setting, Lindsay and I, we used to work for the Department of Mental Health, and we're seeing pretty high risk, vulnerable populations. And so that was probably a little bit more acute than what we're seeing in private practice. Even in that setting, the situations in which we were where we really needed to break confidentiality, they were kind of few and far in between. And so then the bulk of our work just seems to like kind of just move along. But I actually feel pretty strongly that there are some ethical considerations that we probably just need to think through a little bit more that affect our day-to-day decision making when we're in a private practice setting, and certainly some of this would apply to agency settings and such. Um, I, we're particularly going to be talking a little bit more about private practice, simply because if you're in private practice, you tend to have a lot more control over some things like policies and procedures and such. And some of what we'll be talking about will be that. So what I'd like to do is just lay a little bit of theoretical groundwork and then start talking application. Okay. And what I'm hoping that we can do is that we'll have at least 10 to 15 minutes at the end of our time where we're going to get plenty of input and be able to do a kind of informal Q&A with you guys on a 16-second delay, which might get a little awkward, but we'll do it and get through it. Okay. So here's something that we probably want to consider from an Adlerian perspective when we're thinking about ethics. So Alfred Adler, basics of the theory are this: that all of us, we possess feelings of inferiority. Okay, we look around at other people around us or at things in the world, and we say, geez, in some way, shape, or form, I'm less than. I'm in a one down position in relation to something else. And then out of those feelings of inferiority, we compensate and we strive for superiority. We try to gain a sense of mastery or excellence or significance in response to that feeling of inferiority. So now Adler also noticed that the depth of the feelings of inferiority also, they're kind of, it's like they match the intensity of the compensation. Okay, so if you're really short, sometimes we talk about people having a Napoleon syndrome, right? That they're quite diminutive in stature, and then they have this very outsized personality, or boy are they tough, or boy are they scrappy, or whatever it might be. And if you feel that you're very, you're really not important, okay, and that's the kind of inferiority that you have. It might be that you really strive to not just be important, or significant, but the most important, at the top of the. If you have no power, you might strive for the most power. If that makes sense, there's a kind of correlation, let's say, between the intensity of the inferiority feelings and the strength of the compensations. Now, the compensations aren't always bad. Okay, by no means are they always bad. Sometimes they drive us to achieve, and in particular, to do things that are helpful to those around us. That's really the kind of compensation or striving that we're looking for. We talked about that a little bit in the last webinar that we did, if you were here for that. So here's why I'm pointing all this out. The reality is that when a client comes to us, okay, as a therapist, they are coming vulnerable, in a position of vulnerability, sometimes in a position of weakness, sometimes in a position where their life is kind of falling apart. They're not very stable. They're emotionally in pain. Okay, and then they come to us, and what do we do? Now, maybe we've got that stuff going on too. Okay, maybe we of course all have our own junk, but how we present to the client is this. Okay, we sit with good posture, relaxed, a kind look on our face, hopefully, and we look pretty well put together. Okay, and I don't know if you can see back over. Wow, this is weird doing this on a screen. I can't do the mirror image thing. But if you look over here, I've got my license hanging on the wall, and it's got a nice shiny seal on it. And I don't have my master's degree diploma hanging up in here, but some of you probably have a master's degree or a doctorate that's hanging on the wall. Okay, and just the reality is, right? They're on our turf, so to speak. um, we at least look fairly well put together and stable. We're educated in a way that probably they're not, I guess, unless your client is a therapist. And there's just all these ways in which it might look to a client, and not always, but it might look to a client like, wow, I am big time in a position of inferiority. Now, some of that is just natural, unavoidable. We can't avoid it. Okay. And I don't want us to trouble ourselves with that. But what I do want us to consider is that there are ways in which we handle ourselves in the day to day processes of our practice that might actually exacerbate those feelings of inferiority, and that, let's say, the extent to which our client senses a division between where we are and where they are. And that's not going to be helpful in therapy the more that's going on. Okay, that's going to invite compensations into the room, and so then we get countertransference or transference that pops into the therapeutic relationship, or perhaps they're a little less likely to be as honest as they could be with us about something, or perhaps they really want to impress us, or to conscript us into their service as a helper, or somebody who will manage their problems for them, or all those kinds of things. And of course, none of that's really helpful for people to find their way through life that's more on the useful side of life and productive, not just for themselves, but also for others. So this is why we're talking about mutual respect and equality, because mutual respect and equality are ways in which we can at least do our part to mitigate the intensity of this power divide, this power differential between us and clients. And that's an ethical consideration for us to take on. If we think of ethical principles like beneficence, and that's okay, do good for your client. Okay, well, to do good, we want to shrink this down as much as possible so that we're not inviting unhealthy compensations into the relationship. Do no harm. Okay, well, it could really be harmful to stretch this out, this differential between where we are and where they see themselves to be. So mutual respect and equality, those are going to be kind of our guiding principles. Now, okay, if I surveyed 100 therapists, okay, if I just went out and grabbed as many therapists and brought them all together 6 feet apart, of course, and I surveyed them and said, okay, is mutual respect for your client a good thing? Probably 100 people would say yes. And if I asked, okay, is treating a client as if they have as though you're equals, is that a good idea? And probably 100 therapists would say yes. But here are the things that I see us doing, and I say us because Lindsay and I, we've participated in these patterns. Absolutely. I see us doing as professionals that don't exactly line up with that. And I think mostly that's happening because we're just not aware of it. And so now we have this opportunity to be aware of it and to just know what we're up to a little bit, and get a clearer sense of what we can do to shrink this power differential and help our clients in that way. So let's talk about cancellation policies. Okay. So Lindsay and I, when we worked for the state government, there really wasn't much of a cancellation policy, in large part because most of our clients were Medicaid based, and perhaps some of you are in agency work. That's a lot of the population you see. And of course, right, that if somebody no-shows an appointment, but they're a Medicaid client, you can't ask them to pay for the session anyway, or give them some kind of fee. This is illegal, and it's appropriate that it's illegal. We don't want to bankrupt people because they didn't come to a counseling session. This is a completely non-proportional response to something. So that we didn't really have much of a cancellation policy. And when we decided to move into private practice and to transition into that kind of work, we had to think through, okay, so how do we want to put together a cancellation policy? Now, most of what we found around and what we've experienced from the therapists that we've been to, it goes something like this, right? Okay, if it's less than 72 hours, you can reschedule. If it's less than 24 hours, then really, then you just have to pay for the session anyways. And in fact, I remember going to a therapist one time, and I completely spaced about the appointment. Honestly, I wasn't in a great headspace. Completely spaced about the appointment. She called me and was like, "Hey, where are you?" And I said, "Oh, I completely forgot." She had a later appointment, maybe 3 hours later, an open slot. And so I said, "Oh yeah, I'll just come then." So I went then, and she charged me for both sessions. And this wasn't unfair. I mean, I had signed a consent form that says, "Yeah, I'll consent to that policy." But the policy was, if you don't show up for the appointment, you pay for it. Period. End of story. So that's sometimes how it happens. Other times, and I see this a lot with supervisees or counselors in training, both when I was coming up as a counselor in training, and then some of the folks I'm supervising now, it's really hard to enforce a cancellation policy. So maybe you have something in your informed consent that says, "Hey, here's how it's going to work. Less than 24 hours, you cancel, or you no-show your appointment where you owe me for the hour anyways." Okay. But then they never end up charging the money, and they never insist that money gets paid. So here's what we have, right? We have a dual concern here. And so there's respect for the client and there's respect for the therapist, and both really, and that's our mutual respect, right? The sense that a therapist, they have rights. Okay, we can't just sit around at our office hoping that our clients are in the mood to show up today and think that we're going to pay our bills. That's probably not going to happen. But also our clients, they should have some kind of room for their life to come in and just to be a human being. I mean, people forget about sessions, and things come up and whatever. So let me tell you a little bit about Lindsay and I and how we designed our cancellation policy. What we decided is anything more than 24 hours, people can cancel, reschedule, do whatever they'd like. Okay, because at the end of the day, what that means is if we have more than 24 hours notice, we have an opportunity to fill up a slot. Okay, and that's pretty fair, and that's a good amount of notice. Perhaps somebody else would want more, but that works for us. Okay. Now, anything under 24 hours, and by that, and I'm clear with my clients about this when I do my informed consent process, anything less than 24 hours, and by that I mean 23 hours and 59 minutes, anything under 24 hours, we either need to reschedule in 5 calendar days. And see, 5 calendar days, again, it's like if I see you on Thursday instead of Monday, that's really, at the end of the day, it's not a huge bunch of skin off my back. It's not a big deal. We either need to reschedule in 5 calendar days, or they need to pay me the full fee for the hour. And that is regardless of emergencies. Now that sounds maybe a little bit cruel, right? Because you say, well, I mean, people have things happen, and that's very fair. But here's why we have that clause where we don't have some emergency clause in there. People's sense of what constitutes an emergency varies widely. Okay? And here's the deal, is that nobody died and made me king of the universe to where I get to decide what constitutes an emergency. Like why should I get to decide that? One time somebody said that they, and not in private practice, this was several years ago, but they missed a session and they said, well, it was an emergency. And I said, oh my gosh, what happened? Just really out of concern. And they said that their cat had thrown up. And okay, for one, I'm not much of a cat lover. Okay, I'm sorry if you love cats, and of course it's your right to like cats, but they're not my favorite. Okay, so I'm kind of like, who cares, right? I mean and maybe I'm getting some rolled eyes or something right now, and that's okay. But that's how I feel. Who cares? Your cat threw up, so what? But to them, it really felt like an emergency. Now, who am I, right? To say, oh, that's not an emergency. And even if, let's even say that I do have the right to decide that. Well, now you see, I'm in a bit of a power struggle with my client. See, there's a competition that we're involved in right now, and we might call it who gets to decide what an emergency is. And at the end of the day, maybe I win that fight. And so what does that do to my client? Boy, it puts them in a one down position, in a pretty good one, right? I mean, they're out of a good little chunk of change because they had to pay me when they didn't think that they were going to have to pay me because their cat threw up, right? So that's no good. So that's why we just don't have any emergency clauses. I'm not gonna get in a power struggle with a client about what constitutes an emergency. Now, the flip side of this, right, is that okay, it can feel a little bit cold and unfeeling, right? That I mean, things do happen. Like, I mean, what if you get in a car wreck, or what if your mom gets diagnosed with cancer or something? And, I mean, and these things happen. And look, those things, they're more important than a counseling session. And I want somebody to go be attending to that. Okay. So here's how we compensated for it. We said, look, the exact same policy applies to us. Things are going to pop up in our lives as therapists where we might have to reschedule uh, or even cancel a session. My son breaks his leg or something. I'm going to go to the hospital to to be there for him, and I need to be there and not in a counseling session. But here's the deal. I don't It's not my right to say, well, this was an emergency, and so therefore I'm excused from not being there. So here's what we do. Anything less than 24 hours, and by that we mean 23 hours and 59 minutes. If we cancel or need to reschedule with a client, we either need to do it in 5 calendar days, depending on their availability and ours, or the next time that they come for therapy, they get it free of charge. Nothing charged to them. And that's so you see there's this equality, there's this mutual respect of you get to decide what's an emergency for you. It'll be your decision and your choice whether you come to therapy. Here's just the structure that we're going to put around that. And by the way, the exact same structure of consequence or outcome, it applies to you and it applies to me too. And we've found that clients just really respond well to that. They almost get this look of surprise on their face, like, "Oh, really?" And I've had clients where I have had to cancel or reschedule, and we can't get it done in 5 days, and it's less than 24 hours notice. And when they show up the next time, and I don't charge them, they have this sense of, "Oh my gosh, he's really keeping his word, and he really meant what he said." And there's just something. It's not just about being honest. It's that I'm being honest about wanting to treat them as an equal, and that there's real mutual respect there. Now, I'm not saying that to be an ethical practitioner, you have to have our cancellation policy. What I am saying is that we need to have some part of our brain clicking and firing and saying, what are there possibilities in how I develop even something like as simple as a cancellation policy? Are there ways in which I might exacerbate a power differential between myself and my client that might limit my ability to do good for them and might even do some harm? Does that all make sense? And if there's any questions about that, I want you to feel free to type some questions into the chat window. But so that's just one example on a policy and procedure level of how we're processing our ethical responsibilities on just a really basic policy level, and how that's informed by something like Adlerian theory saying that people are prone to feel inferior, and often when there's these big power differentials, you're going to get these big compensations, some of which are not going to be very helpful or healthy. So cancellation policy. Here's another thing that I see coming up pretty frequently, and this is both from licensed professionals and then also from counselors in training. We often seem to feel as therapists, and by the way, I'm in this boat with everybody else, okay? We seem to feel that our clients owe us honesty. And this is mistaken, and it probably is coming from a place of good intent, right? Where, and when I talk to clients who maybe get a bit upset about clients being dishonest or really not telling the truth, um, it's because they're frustrated by the limit that it puts on their ability to help, right? It's not so much some power play. But here's the deal: when we put ourselves in a position where we feel entitled to our client's honesty, uh, what then happens, right, is that our clients, they're gonna lie to us, okay? And maybe they're like really small lies and we don't know about it. Maybe they're small lies and we do know about it. Maybe they're big lies and we don't know about it. And maybe they're big lies and we do know about it. Okay, and there's plenty across the board, but clients are gonna lie, or at least give us half truths. They're going to tell us half the story of the argument that they had with mom or with their spouse or something or other. It's just going to happen. And when we become aware of their dishonesty and we feel entitled to their honesty, we feel that we've been wronged. You see, and this, now we feel in a one down position, and the client's in the one up position, and we're in this competition of who really knows the truth, and the client wins because they know the truth and they've deceived us. Okay, and this is not helpful. And the kind of compensations that it brings up for us often is that we can get a little bit indignant and put out with our clients. Sometimes we shame our clients. If we're just being really honest, okay, I'm not saying that, oh, I've done this and I'm proud of it at all. Okay. But I am saying this happens. We do this. We shame our clients for being dishonest. Um, and none of this, of course, is of any use to their movement towards a healthier life and the useful side of life, where they can really be in a healthy place where they're equipped uh, to help others around them. So here's what happens, right? Here's how these things come out. Uh, Sometimes we leverage the therapeutic relationship itself against clients, right? Where we say, Billy, this is the third time you've not been honest with me about your drinking, and if you can't tell me the truth about whether or not you're drinking, like, you know, maybe we can't continue this. Well, now part of me looks at that and says, okay, I see somebody setting a reasonable boundary, right? And kind of in part setting a boundary about this is what therapy is, right? It's an honest conversation about what's going on, and it kind of seems like maybe you're not all that invested in that process, and so I hear that, right? It's not a baseless boundary to make, but on the flip side, right? Is it the best thing to do to give the client the message that I, as your therapist, I'm entitled to the full and unfettered truth about you, and if you don't give it to me, I'll leave the relationship? That I don't know if who all out there is married, but if that's how we treated our spouse, if that was kind of the way that we treated our spouses, it would be uh, again, it's understandable that we might want to set some of those boundaries, but probably would not help the relationship as a whole. Because again, what we're doing is we're saying who we're going to have a competition. The competition goes by this name: who knows the truth and who doesn't, right? And we don't need to be in competition with clients. This never really produces positive results for clients in my experience, and that's both as a therapist but also as a client. This is not helpful. Another maybe extension of this is that we develop pet theories about clients. Okay, they say something, and this little puzzle piece in our head fits into place, and we say, "Oh, I see it." And isn't that such a beautiful case conceptualization? And you think you know maybe you wouldn't do this, but you're thinking, man, that would be, if I could write this case up as a case study, it would definitely get published, because that is just such a beautiful, perfect little case conceptualization. It just fits exactly right, and you decide, oh, what this is really about, your anxiety, what it really comes down to is that mom, when you were 7, you wanted a pony at your birthday party, and instead she brought a donkey and made fun of you about it. Okay. Now, could you be right? I mean, you could, right? I mean, I don't know, maybe, but the thing is that if the client, if you put that out there for the client, and you even say it that way, here's what the deal is. Okay, let me explain you to you. This all goes back to mom and the donkey and the pony. Um, well, now what you're doing is you're treating yourself as the expert, okay, and they are the student. And of course, I'm not saying that there's not a didactic feature to what we do as counselors and therapists. But sometimes we have to teach people some things, and so I'm not saying that that's always bad, but there is a kind of thing where we can insist upon being right about something, and particularly when we're insisting about being right about a client's own life and their own experience. This is not something that communicates mutual respect and equality. Okay, and instead of taking on that kind of approach, we can do the great old Frank Walton thing of using the words "could it be that," or I think he shared with us in the chat window during our last webinar that sometimes it's a great idea to let a client know, hey, I'm going to need your help to make sure that I'm on track. And see, that's mutual respect. I've got my thoughts and you've got your thoughts. You can't make me think something about you, nor can I make you think something about you. Uh, you've got your perspective, I've got mine, and one isn't more valid than the other. And that's the equality piece. And so when we just engage with folks as equals, right? And maybe we put something out there, we say, oh, could it be that maybe this anxiety that you're having, does this go back to mom and the horse and the donkey and that awful 7th birthday party? And they say, no, it has nothing to do with that. Now, look, maybe as a therapist, we look at them and we read their body language and we say, I'm not sure. I'm not convinced. I kind of think that I might still be right. Here's what we can do though. Okay. We can respect ourselves and our clinical intuition. We don't have to throw in the garbage can. We don't have to do away with it. It's not required because it's not a competition, right? It's a cooperative endeavor between therapist and client. And so what we can do is to say, boy, I must just be a little bit off there. And it sounds like I have some more listening and learning to do. Thank you so much for letting me know that I wasn't on track. We'll keep at it because I really would like to understand. Now, here's the deal. If you're right, okay, if you really are right, and you continue to treat your client with mutual respect and equality, you really have a shot at getting them to see that. But see, if you're in competition with a client and they feel like what it's become between therapists, between themselves and their therapist, is this competition over who's right about where the anxiety comes from. Well, even let's say that you're right, that it all goes back to mom and the horse and the donkey. By the way, this is like the worst example. I don't know where mom and the horse and the donkey. This is not from the annals of Calvin's history. I don't know where that came from. But let's even say you're right, and they know it on some level. Well, they're going to shut that part down. See, because to acknowledge it, it's also to wave the white flag and say, okay, I give up, you win. Whereas if we're just treating them as equals, there's nothing to be gained by shutting down that insight once they're really able to get there. And then also, let's just acknowledge this. As well trained as we are, and perhaps as good as our intuitions can be, okay, and I'm confident in my clinical intuitions. I think I have a really good sensibility about what's true about people and where things come. I feel really competent with case conceptualization. But here's the deal: I'm wrong all the time. And that's not because I'm stupid, and it's not because I'm not well trained, and it's because I'm just a human being. And sometimes I just miss things. And so we also put ourselves in a position where maybe we're the ones who, we don't want to lose the competition and wave the white flag. And so we adopt a pet theory, and boy, we're really protective of it. And we're not going to let it go, because if we were to let it go and say, oh, I guess I was wrong about that, then what that means is maybe we feel like, oh, I'm not a very good therapist. I can't figure this out. Well, I'm wrong. And that stirs up all this stuff in us. But if we just treat ourselves, oh, I'm just a human being. I'm an equal with this client. We're cooperating. I have my skills and my insight and my intuitions to bring to the table, and they have theirs. And let's see what we can do with this. And it's all mutual respect and equality. Nobody's in the position of expert or student or anything like this. Then we open up all these avenues that we could close off if we feel really entitled to something like a pet theory or being the expert for our clients' lives or something like that. Okay. Again, keep the questions coming. If there's any questions or something that we need to clarify, just type that in the chat box and we'll get to it as quickly as we can. There's 16-second delay on this. So, okay, let's just talk very briefly about confrontation. Confrontation is a really important therapeutic skill. I think an underdeveloped therapeutic skill for most folks. In part because perhaps as therapists, we're apt to be a little bit more on the agreeable end of things. If we think of our 5-factor model of personality, that agreeableness piece, therapists, we tend to be pretty high. We score pretty high on agreeableness, and that's just that part of us that we're eager to kind of accommodate, and perhaps we're a little bit more of a peacemaker. And of course, I'm making broad generalizations. There's lots of therapists who aren't particularly agreeable, and that of course doesn't make them a bad therapist. I'm not saying that at all, but we just tend to be more on that end of things. And so we sometimes really struggle to develop good confrontation skills. Paul Rasmussen, a professor of mine, said that therapy for the therapist should be like this, that we're both holding our clients' hands and giving them a swift kick in the ass. And I think that's a really great way to put it, that there's this tension that we really do need to be caring. We can't just be an ass kicker, but we also can't just be a hand holder. Sometimes our clients really need to be confronted with what they're up to, and they need to see a truth, even if it's really unpleasant to see. So confrontation, I guess you could make the case, if you're a strict person-centered therapist, maybe confrontation skills aren't real, quite as central. And maybe if you're more like a Fritz Perls or an Albert Ellis type, confrontation is going to be very much right at the center of how you work. But all that to say, all of us therapists, whatever therapeutic orientation we come from, we really need to have some ability to confront our clients with unpleasant truths. And with that being said, there is more than one way to confront, okay? And sometimes how we confront clients is we confront as a disappointed parent. Okay, we say things like, oh, why, we've talked about this. I don't know how many times as a therapist I've either been tempted to say that or actually said something along those lines. Oh, we talked about this, oh, you can't be doing that, and you get a bit exasperated and you find yourself kind of pointing your finger or wagging your finger like a disappointed lecturing parent. Okay, and this, of course, part of what I want y'all to see here is power differential. There's a difference in equality. There's not a mutual respect that's there. Sometimes how we confront clients, we confront them as as experts, okay, as condescending experts that say, look, I have the answer. I'm going to tell you what to do, and all you have to do is do what I tell you. Okay, and look, I mean, it's probably not going to come out in those words. It might, honestly, but it might not come out in those words. But if we're really honest with ourselves as therapists, can we really say that that's not something that's boiling up inside of us? Of like, would you just do what I'm telling you to do? Okay, and maybe that's coming from a good intent to really help our client. But look, what we're doing is we're exacerbating this power differential between us and a client, and all that that's going to serve to do is invite competition and compensations from our client and put them in a one down position and pull up into their behavior patterns all the things that we're most trying to help them change. Oh, now Kevin, you shared something. Definition of confrontation means to put in front of, similar to Kurt Adler's notion of helping to see what they're up to. That is such a great way to put it. Really, one of my all-time favorite quotes that I've been made aware of is Kurt Adler's sense that the best thing that we can do as a therapist is to let a client know what they're up to. Such a good idea. Applies really across the board, whole bunch of different therapeutic approaches and theoretical orientations. That's a true statement, and so that's a great way to think of confrontation. Now, here's how we can confront out of mutual respect and with a sense of equality. For one, what we do is that we never put a client in a position where they are somehow aberrant and outside of understandable patterns of human behavior. Okay, and what I mean by this is that let's say you've got a husband who's cheating on his wife. Okay, now it's a sorry thing to do. Okay, this is not a good thing to be doing, and perhaps for some of us even that pokes on some of our own hurts. Maybe our dad cheated on our mom, or something like that, and so it stirs up a lot in us, and it's really tempting to put them in this category of, oh, they're just they're so that way. Oh, he's a womanizer. He's a such and such. And we certainly do this with, if we think back to DSM-4, when we talk about Axis 2 disorders, right? We talk about people this way. Oh, she's so borderline. Oh, he's such a narcissist. We do these things where we put people in these categories like they're almost like a different species or something, And this is a way of, it's contempt is really what it is. Contempt is our distancing emotion. It puts emotional distance between our self-conception and the other conception, the conception of the other. And this is not good. This puts somebody in a position of superiority. Well, I'm like a normal person, and they're in this other category. They're so borderline. They're such a narcissist. He's such a womanizer. You see? Whereas rather what we really need to be doing, my rule for myself, and I'm not saying everybody has to have this, okay? But there's a sense in which I have a rule for myself that I don't confront until I can really understand the behavior that they're engaging in. Meaning that I'm not going to confront somebody until I say, it makes so much sense that they would. Now, some behavior making sense is different than giving it a thumbs up and saying it's a good thing, right? But to say, oh, it does make sense that they would do that. So, for somebody who perhaps is a bit more on the borderline spectrum, for us to understand, it really does make sense that attachment feels very frightening to them. And so that here's this person who's really trying to treat them well, and now they're responding and treating them like dirt. Oh, boy, that does make some sense. And so that's the way that we can approach them, is just to say, I'm not in your shoes, I can only get in your shoes the best way that I can. But as I'm thinking about this, it just does make some sense that would be really scary for you, or that it is really hard for you when somebody gives you criticism. I'd imagine it just feels, pretty disgusting to you, and so it's almost like you're so ready to do almost anything to get out of that. Or, man, I get the sense when we talk that you're just so lonely in your marriage, and that you're looking for some kind of connection wherever you can find it. And it occurs to me, maybe, could it be that when you go cheat on your wife, when you do that, yeah, absolutely, you're looking for connection, but it could be that you're missing the connection that's available to you, and actually making it harder to get that within the confines of your marriage. And do you see, that's equality. That's saying you're a human being, and I'm a human being, and we're just going to relate on that level. I'm not coming to you as puritanical. I live my life in order, and I know all the lines of right and wrong, and I'm here to enforce them. Judge, jury, and executioner. That's a position of superiority and putting them in a position of inferiority. If we can just get in the middle and say, oh, it makes so much sense that you might do that. Makes so much sense that you might do that. But could it be that that as you're doing that, you're really making something worse? And that's an empathetic way to do it. And again, what we're doing away with is a potential competition between us and client, right? Because they don't want to lose a competition. And if we can show them as therapists, hey, I don't want to compete with you. I want to cooperate with you. I want to interact with you as an equal with mutual respect and a sense of equality. Those confrontations, they're actually more likely to really see them and respond to them in a way that's helpful and therapeutic. Okay, now I've talked plenty, and I saw the chat popping up here. Okay, Frank, I had not realized it would be an ethical matter to cut through disrespectful conversation by saying something as, Bill, I'm not certain I'm being of much help right now. Maybe I'm mistaken. Well, and I guess this is part of why I wanted to run this little webinar, is that we talk about kind of the heavy hitter ethical issues quite frequently. Okay, everybody knows, don't sleep with your client. Don't be accepting, don't buy a car from a client. Don't breed puppies with your client's parent. Don't, these kinds of things that are perhaps more obvious and straightforward to us, but also are pretty rare, right? But when we think about kind of the first two principles of ethics, of beneficence, of do good, and non-maleficence, don't do harm. When we think about those things, we can get into more of the high definition questions of ethics if we consider some of these things like cancellation policies or our sense of entitlement to client honesty. Because the question is, how is it that we can treat our clients in such a way that we're not doing harm and helping them in the most optimal way? Now, we're going to make mistakes. And of course, I don't think anybody should lose their license if they have a certain cancellation policy, or if they develop pet theories. Okay, the truth is that if I thought that were the case, I would think that I shouldn't have a license, because I've done that. I've developed pet theories. But if we're just seeking to be the most ethical that we can be, when we come in with a mindset of equality and mutual respect, part of what we do is we start to get out of the way some of these everyday things that we're doing that both limit our ability to do good and also potentially do some harm and limit our ability to be most helpful to clients. Now, Kevin, you say universities, small towns, church, parties, grocery, how to handle those sensitive situations. Should this be discussed ahead of time? Okay, now, wide variety, I think, of how people can handle this. I'll tell you how Lindsay and I handle this. In my informed consent process, I always, first session, like first 5 minutes of the first session, I go through this in detail, and I make very clear, hey, if I see you in public, I want you to know that my responsibility is to behave as if I don't know you. And I want to be upfront with you about that, because it's not because I don't want to speak to you or that I don't like you or anything like that. I don't ever want to put you in a position where you need to explain to someone else how you know me. Now, no such requirement sits on you. You're free to come speak to me, but it won't offend me in the least if you don't. I won't take that as any kind of rudeness or anything of the sort. Now, you added to your question, with their spouse or with their lover while married, what then? Our response. Well, that's a really great question. That's a really great question. I think let's take perhaps the most awkward of these situations, where perhaps I'm downtown having a beer with a friend, and I look over and there's my client having a clearly non-professional get together with someone who's not his wife. Well, Here's probably what I would do. I'd probably leave the bar, in part because I don't want to have it be that the client looks over at me and now is terrified to come to their next session because they know what I know. Okay. Um, or at least have them not having to have it be that they're looking over every 35 seconds to say, oh my gosh, my therapist is over there. Boy, this is getting really uncomfortable. Or where they're, perhaps that's just maybe only going to invite more dishonesty from my client, where maybe they're going to they're going to cook up some explanation for what's going on there. Now, if they came to session, I'm not sure what I would do about broaching it. Again, I would certainly not confront unless I had a really clear sense of what would explain the behavior. Just on and I don't mean necessarily accurately, but just to have a sense of, oh, that would make sense that they were such and such. Okay. Now, if they brought it up and they said, oh yeah, I saw you at such and such a bar the other night, I'd say, oh yeah, I saw you there too. I noticed that you were with somebody. Can you tell me about that? And then they're free. Maybe they say, oh, that's just my friend. And I say, oh, okay. And then I move on. Okay. Now there might be a later time that I'd circle back around to that if, again, the pattern of their behavior and the movement of the therapy takes us back there. But what I don't want to do, right, is to perseverate and just to kind of obsess over this moment, to make a point. Okay. And the idea is that if we trust the process and the movement of therapy, particularly when we're treating a style of life like we would in Adlerian therapy, the reality is that we're going to get back around to whatever created that issue. We're going to get there. So, and you just added, do male therapists have any special duty that might be different from a female therapist? Does Lindsay confront different situations than you, ethically speaking? Great. That's a great question. Lindsay's telling me, I don't know if you could hear, but she says she does it just like I do it. Part of that might be I'm very in touch with my feminine side. Okay, I rock some good feminine energy, and so it might be that perhaps I'm a little bit more on the feminine end of things. Also, Lindsay's pretty tough and spunky, and maybe exhibits some more stereotypically masculine features. Of course, I'm not saying that femininity should be associated with weakness or not being tough. I don't mean that at all. So it might be that we're just a little bit, both of us are a little bit outliers, and so we're a little closer in how we manage things. As I'm thinking about this, I'm not sure that, as I'm just thinking about theoretically, there's no clear difference that would occur to me between how a female therapist and a male therapist should handle things, with this exception, that when we talk about mutual respect, again, the therapist needs to have self-respect. Okay. And so some of that might be that they need to respect their intuitions and what they're comfortable with. I'm pretty comfortable being pretty direct with clients about things. Again, if I have the sense, yes, it would make sense that you would. I really have no trouble being very direct with them. Other folks, they might not be quite so in line with that, and they might be able to find a different way to confront. But I'm not sure that would depend so much on the male-female spectrum. Any other questions about any of this? We'll give just another minute because I know that this has to catch up just a smidge. Okay, I think maybe we don't have any more questions, and so I want to spare everybody the awkwardness of watching me sit here and squint at my screen. I am so thankful that we got to do this. I've been thinking about running a little seminar like this for a while to talk about ethics in things like basic policies and procedures, cancellation policies, and stuff like that. So this was really fun for me to do, and just fun for me to think to share some ways in which Lindsay and I think about things. Really, really fun. Oh, Kevin, you're saying, do clients read your notes? I make my clients generally don't read my notes, but it's not because they're not allowed. And in fact, and during the first session, I say I have a legal pad just like this during my sessions, and I write things down. And I make clear in the first session, I say I'm going to write some things down. If at any time you would like to see what I'm writing down, you're more than welcome to see it. And part of what's good about that is it keeps me from writing things down like clearly has mother issues or a judgment. Rather, I'm mostly recording meaningful information that pops up so that I can remember it a little bit. And of course, I have the session documented just to comply with ethical and legal standards out there. So there is another question. Do male therapy? Nope. Will you be doing any more ethics training in the future? I know we have to have about 6. I'd love to do a little bit more on ethics. And the truth, really the truth is, guys, is that we really need to hear a little bit more from my partner, Lindsay. She's got a really great brain about things like this. And so I'd really like to do something. Maybe we'll brainstorm and come up with some things that maybe we could do. And yeah, I know these ethics specific hours that we have to get in South Carolina, they're kind of hard to get, and some of the stuff can kind of get repetitive. So maybe we'll figure out a creative way to do that. But thank you for your interest, Brittany, and for your participation tonight. It's been awesome. Okay, Lindsay's letting me know you have the evals in an email that she already sent to you. So if you'll fill those out, send them back to her, you will get a certificate in response that you can print out and keep for your records. And one more thing from Kev. Okay, not a question. Kevin, you joined us from Jamaica. That is so wonderful. We're international here. This is great. We had Romania last webinar and Jamaica today. This is fantastic. So glad that you joined us. Maybe you'll join us for another one in the future. We've got 2 more this month. So. Oh, and yeah, definitely join us for the next one, because there will be a counseling demonstration of a really fun technique that Lindsay and I use. I mean, we use almost constantly with our clients, and it's really been helpful to us. So until next time, we are really thankful that you guys joined us, and we look forward to meeting you hopefully in person in the future, but certainly having you with us maybe on another webinar. Thanks so much.